Hey everyone, Shannon here with the VBC1 team, and I know that you're all aware, or at least you all heard the announcement that dropped last week from Dr. Oz that CMS has been behind on audits, but no longer. They're going to be fast tracking those audits, and if you're a health plan, a risk-bearing provider entity, or a provider enablement company, you're going to need to be ready, like yesterday. Lucky for you, the VBC1 team has 7 easy steps that you can take to make sure that your organization is audit ready. All right, are you ready? Here we go. Know your risk because everyone's accountable. CMS audits don't just stop with the health plan. Risk-bearing provider groups and increasingly provider enablement partners are being held accountable too. I've seen liability contracts that pass down risk. That means that if you're part of the chain, you could be on the hook for penalties and overstatements too. So here's your action item. Review those contracts. Understand if and how liability flows to your organization. Step number 2. Build a solid foundation built on policies and procedure. Every organization submitting risk adjustment data needs documented policies and procedures on coding practices. These must align with legitimate coding sources like the official coding guidelines and the coding clinic. Your checklist, document your coding rules. Define your process for adding and deleting diagnosis codes. You need to make sure that you have that two-way look. Implement an annual review cycle that includes calibration. You need to demonstrate and prove that you're following the rules consistently throughout the year, and make sure that you're getting a medical director and senior leadership to sign off to demonstrate oversight at your organization. Step number 3, audit like a pro, the full record, not just the line item. While an audit may come to you with a specific date of service, know that you can, and I have, on several instances, been able to successfully defend a diagnosis code by reviewing the full performance year. As long as you can demonstrate that that diagnosis code is substantiated for that given performance here, maybe it incurred on a different encounter, you can keep the code valid and avoid the clawback. My tip to you is always look at the full medical record before responding to an audit. Step number 4, spot risky coding patterns. Know what those red flags are in coding. Audit your data for these common pitfalls. Acute codes in the outpatient or home visit settings. Codes documented only once a year, especially chronic codes like diabetes and cancer, where we know and would expect patients to have more than one encounter in a given year. Look for those diagnosis codes captured only in a chart review or in a home visit without appropriate provider follow-up. Work with your physician network and your vendors to validate conditions and help them understand why appropriate substantive documentation at every encounter matters. Every encounter. Step number 5, organize for defense. Make sure that you have a document repository. You can't defend what you can't find. Create a centralized, well-organized document repository. Make sure that it's curated by someone who understands coding and documentation so you can find what you need to when that audit letter arrives. Tip number 6, designate an audit response lead. Have a dedicated audit coder or coordinator who oversees record pulls, gathers evidence for codes, ensures your response meets CMS deadlines. This person should understand what constitutes acceptable documentation, because CMS deadlines are strict and timelines are tight. And finally, step number 7, continuous readiness. Don't wait for an audit. Regularly test your audit response process. Perform internal and external audits to simulate the CMS process. Document your findings and address any gap. Build a culture of compliance and integrity. This isn't about ticking boxes. It's about delivering high quality, accurate care. The bottom line, the CMS audits are coming, and they're coming fast. Whether you're a health plan, a risk-bearing provider entity, or a provider enablement company, the time to prepare is now. Get your policies tight, your practices tested, and your teams trained. Let's protect our organizations, our patients, and the integrity of the healthcare system. If you need help, whether it's policy development, audit prep, or training your teams, know the VPC1 team is here. Let's connect and get audit ready together.